Thank you for joining us. Those of you that were able to make the jump and those of you that are watching the recording later on. We're doing both, you never know. I'm just going to hand it over to Deb to get started. I don't want to take up much more of your time. So Deb, whenever you're ready.
Okay. Well, I'm going to get my screen up and just give a quick welcome. Oh, wait, for the wrong thing. See me, technically challenged. Right. And there we go. Okay, is it showing?
It's not, no.
Wait a minute, let me, oh wait, there we go. I gotta hit the right button. Technology.
Technology.
Okay. Now we are, right?
We are, yes,
Yep.
It's not
Okay.
in presentation mode, but it's up there, yeah.
I can do that. Okay. There. Is that better?
It's taken a second to.
There it is.
Seeing it,
Slowly.
yeah, slowly. I'm still seeing it in the PowerPoint view, not the presenter view though.
Okay. Use slideshow.
Is anyone else seeing it in presenter view? Might just be my internet lagging. Either way, I think we're good to
Okay,
go.
we'll go as long as you can see something.
We see something.
So real quick, first of all, I want to thank all of you for your time today in the middle of the day and probably busy still. And, I understand, this has been a challenging year with instruction, and you're all doing, the best you can, and trying to wade through all this, and probably especially trying to understand the equine world. So that's what I'm hoping to do, is just bring you a little insight and, shed some light on the equine veterinary profession. I've been in it for 38 years plus, and went through a veterinary technology program at Cedar Valley College in Texas, and actually went back and was an instructor at that program for several years. And then also I've been an instructor was an instructor for several years with the Penn Foster program. So I'm familiar a little bit with, I say a little bit, somewhat with, what goes on with instruction in a veterinary technology program, although I haven't been there, in several years now. So hopefully things have changed and gotten better. And so that's kind of what I wanted to do, plus let you know about the AAEVT in case, some of you aren't aware of this association. We were formed in 2004. Took a couple of years to get it up and running. I'm the founding member, if you will. And the reason that we got this going is because there really wasn't a place for the equine veterinary technician, assistant, or support staff. And we, to be honest, we got tired of listening to Hill's nutrition talks at all the conferences. We wanted some equine. So we started this association. It's taken off. We are a community, and, that's more or less our focus, as well as education. We do, promote networking, educating the public and the veterinary profession as to the value and benefits gained by employing a veterinary technician, credentialed or just trained assistants. We have a great relationship with the AAEP, which is our sister organization, which is the American Association of Equine practitioners. So I guess if I can draw a parallel, it's kind of like NAVTA with AVMA. That's who we are with the AAP. And both of these associations were formed because the equine veterinary world is very, very different, and we don't fit into the small animal box. And so we needed a place for our networking, our continuing education, our purposes, and just, being able to discuss, network, and grow that particular community. So we've done a lot in our 18 years. We've got a great website, and that was up on the first page. We have a Facebook page. We have about 65, almost 7,000 followers. And we put on regional, national, and state continuing education events. We have an online equine certificate program. I'll go into that with you. And we have, we've modeled a lot of what we do as far as our organization after the AEP. So we have regional contacts who are spread out throughout the United States and Canada. We've got great relationships with BIVA and the BVNA, and also Australia. Member benefits and anesthesia society, and we're also working on a practice managers society. And again, because those needs are so different from small animal. We helped form an academy, which is one of the approved academies, and this was formed in 2009, I think. We've got scholarships, which you'll want to know about those. And then we do a very in-depth newsletter in the spring and the fall. And then we also send out monthly, what we call hoof beats, which are email blasts with, a lot more, just more relevant information. And then we have some educational partnerships with other equine associations throughout the United States, the Florida one, the Texas one, the Northeast one, the Northern California one. And we work with publishing houses such as The Horse, Equine Management, and Modern Equine Vet to get our articles and information published.
Deb, sorry, excuse me real quick. Are your slides meant to be advancing?
They're supposed to be, but maybe they're not. Maybe I need to get back out and do it again, because if you can't see it, that's not going to work.
Yeah, I think we're still seeing the first slide here.
Oh.
We just went to accomplishments.
Presenter view. Okay, there's where I probably didn't do it. I did slideshow. Is that better?
It should be. Well, we're still seeing it in the regular PowerPoint. That's really odd. Is it opening up on a different screen? Do you have two screens?
Nope, it's just right here. Let me. Okay. So I'm screen sharing now.
Mm-hmm.
And let me just go up and do it this way.
Yeah, that would, yeah, okay.
Is that better?
Yeah, that works. Mm-hmm.
Okay. We'll just work with technology here. Okay. So I'll scoot on down here to, where I was. Thank you for letting me know that. I was just whipping along. And so those are the accomplishments that I just kind of went through. Our membership is right about 900. We are the second largest independent technician association. We've got members all over the United States, Canada, and as you can see, throughout the world. And there's some countries there that aren't listed yet. We do have the potential for at least 7,000 members, because that's how many members the AEP has. And each of them has at least one staff member. We are an inclusive association. So our association is open to not only credentialed veterinary technicians, but assistants, practice managers, office staff, students, and anyone who's actually working in the equine veterinary field. Because we all need each other to make this work. Let me see if this will work. Oop. Uh-oh, what happened here now? Good. No. Ah. Let's see. Mhm. I hope I don't have, there we go. Wowzers. Technology. So these are just some quick pictures of some of our events. We do lectures, wet labs, and fun events. And it is open, you know, like I said, to international student and technicians. These are our rates. We do also offer a discount for large practices, such as your Rudin Riddles, Haggard's, Peterson and Smith, and some of the universities that would be enrolling, you know, more than one. And our membership is 1 year from the date of application. So it's a rolling 1 year. We offer individual student memberships for $25. They get a discounted registration rate at many of our conferences. And then we do offer a student program where 8 of your students and your equine director or instructor can join for $150 for all of the same benefits. And that's just another quick overview of some of the benefits that we offer. And then we do put on regional symposiums every year, as last year, not so many, but this year we have our first event coming up in June. It's going to be an anesthesia event at Montana Equine. And we have partnered with the Big Sky Veterinary Technician Association there to bring about that equine anesthesia event. Then we have, we partner with the Texas Equine Veterinary Association, the Northeast Equine Association, through our Anesthesia Society, which we also have a certification process there, where you're doing a introductory and advanced CE event down in Ocala at, you know, all of ours are at equine veterinary facilities. Then the Purina Annual Equine Veterinary Conference, last year it was virtual, hoping this year it's in person. It's always in St. Louis, and any of our members are invited to go, totally complimentary. It's about 25 hours of continuing education. You get to meet the Budweisers, and so it's a great conference. Don't have any updates on that, but we will. And then our annual conference is in Nashville, Tennessee. It's 4 days of lecture. We have a full day of wet labs. And you get to also attend not only our AAEVT lectures, but the DVM lectures as well. And this is just our flyer on the Montana anesthesia meeting. And then this is our Academy of Equine Veterinary Nursing Technicians. And the designation there, we have an equine manual for veterinary technicians. And we are in the process right now of revamping that and coming out with our second edition, hopefully be available the end of this year or early 2022. For any of you who are instructors, well, you all are, you can contact Blackwell Wiley Publishing and receive a text for, you know, your instruction, which I think is very helpful because this has been developed by experts in the equine veterinary field, as well as equine veterinary technicians. Then we also have an online certificate academy. And the reason we developed this is, you know, we realize there's just a lot lacking in the veterinary technology programs recognized by the AVMA as far as equine. And, you know, the AEP was asking for more training. Our members were asking for more training. Students that were going through veterinary technology programs were asking for more training. I went with the AVMA many, many times trying to get more equine on the programs, and just, you know, that wasn't a priority. So they encouraged me and our group to develop this program. And it is self-paced, it's all online. They do have to go through a clinical competency skills list that's signed off by an AEP veterinarian that they are proficient, and it's fairly robust. And then they have to attend and participate in one of our AVT regional continuing education symposiums. And we actually sign them off on their horsemanship skills. And the sign off is done by one of the AAVT board members or a VTS. And what we're trying to do here is create a standard that the practitioners and the employers can trust. It can be utilized alongside an AVMA veterinary technology program. And it's used as a career ladder in a lot of practices. This is not a shortcut to become a credentialed veterinary technician. It is not a shortcut to become an equine veterinary technician, which we get a lot of requests for. There just is no such thing. This is a certificate of completion recognized by us and the AAEP, which would be their eventual employer. And I kind of, went with this. There are several online colleges that offer programs that permit students to do their preceptorship at some of the recognized equine facilities, but often the students also have to find their own facilities, which is extremely challenging depending on your location. So I'm hopeful that there's a place there for the AVT to assist with that. And we do promote those programs that do have an equine focus as far as their facilities, their access to horses, their instructors, and their breadth of study. Because we do get a lot of questions, where can I go to get, more equine if I'm going to go through a veterinary technology program? And so we do have a list of schools that we do recommend. So again, if you feel like your school, is one of those, let me know and we can put you on that list. And so the goal of this is, to set a standard so that practitioners and the employers, can trust what their graduates of this program have gone through. And our long-term goal is to, promote credentialing. However, we also realize that's a challenge for a lot in the equine world because there is not a lot of equine being taught. And so they're very hesitant to go into a veterinary technology program. And we also want to promote, assistants to recognize their role that they have played so far in their career in veterinary, in the equine veterinary world. There's assistants that have been out there 25, 30 years. I've learned from a great deal of them. And they just have chosen not to go the credentialed route. But that really doesn't mean that they aren't just highly skilled, highly knowledgeable technicians. And so we also wanted a way to recognize those individuals and, encourage them to get training. So these are some of the challenges I've seen from the AVMA veterinary technology programs, and I welcome if any of you, want to add to this, because that's where I hope we can work together to bring about some solutions. There's often not enough equine-oriented, applicants or students to warrant you spending a whole lot of time on the equine curriculum. Especially if you only have one, and everybody else is scared to death of horses. I hate cats in a veterinary clinic. I love cats, but I hate them in a veterinary clinic. And horses can be intimidating. I absolutely understand that. And a lot of times there's not enough equine veterinary trained instructors. I mean, I've seen many schools where they just grab a small animal instructor and go, you get to teach the equine and large animal, because we don't have enough, qualified trained instructors to do that. And that puts, I think, instructors in a hard position too. They don't have the resources or the knowledge or the background to instruct appropriately. And the biggest thing for sure is probably access to horses, donkeys, and herds of horses. And again, I hope this is where the AAEVT can help, give you some ideas on, where to partner with rescue operations or, places that are holding horses for a variety of reasons versus going to, owners and trying to beg, borrow, and steal one or two of their horses. Resources and support, I think, is difficult for you in the equine realm, trying to teach and instruct. And this is one of the biggest challenges. It's very difficult for those who've already been working in the equine industry, at a equine practice or at a, university or wherever they've been. And for the most part, most of them have been working for a while and know that this is what they want to do. They just want to work with horses. They don't want to do small animal. And it's very difficult to encourage them to leave their current place of employment and attend a college to study predominantly dog and cat. And then they come out and, maybe they have kept their job or maybe they haven't. And then they have to try and go back to their original position or areas of responsibility and hope they can step back in, or someone else has already, taken that over in their absence. So we hear a lot of challenges to going back to school, and going to college and studying when it's not, the area that you want to focus on. And if there's questions, Jess or Izzy, that I need to answer while I'm doing this, please stop me. So a lot of the CVTA guidelines are still outdated. We've tried to send them what we feel, they need to incorporate. And I think a lot of it is, and I'm sure there's challenges on the small animal side, for sure, but they're not actually seeking input from the actual employers, the actual equine practitioners. And part of that is, the equine practitioners don't have a real good understanding of what is being taught in the veterinary technology programs. We try and educate them, but I think there's a real difference there between your small animal veterinarians who have a better relationship, I think, with your veterinary technology programs than the equine veterinarians do. And there's probably a lot of reasons for that. Also there's a challenge with the VTNE relevant questions that, actually test more of the skill sets that the equine veterinarian or the equine technician needs to know and wants to know. I mean, for myself, this was a while ago, but I know I received one question on my VTNE that was equine related, and it was a picture of a horse pick. That was it. That was the only question that was equine relevant. And that's a little disheartening too. And I hope, that there's more relevant questions that, people feel like they're actually getting tested in their area of interest. The group demonstrations are often not enough. And I know that's a good majority of the equine skills can be checked off just through a group demonstration or watching. And that's, I think, putting your students at a disadvantage because they come out saying, oh, yes, I know how to do that. But in real life with a horse in a situation where, horses are big and a lot of people can get hurt. And if they really don't know what they're doing or haven't seen it and actually done it, I think that puts students at a disadvantage. And I actually got off a call yesterday with a task force, and several of the veterinarians, when they knew I was doing this talk, they said it's very, I don't even know the word here. It's very difficult for them to be asked to video and submit for students, and this is probably in your online programs, you know, during their workday and when they're in front of clients and with client horses, there's a lot more of confidentiality that it goes on in the equine realm. And to ask DVMs and those practices to help those students video while they're working with clients and horses, I would suggest that you not promote that, because it just gets your practitioners put in a very difficult situation, and they don't like doing it. And what's going to happen is they're going to stop working with those programs and those schools that ask them to do that. So I'm just wanting to pass that on. Again, let's look for solutions, how we can make this work. And then, as you all know, there's not enough time in the program to properly teach, show, and have individual instruction so that, you know, your students actually do get hands-on. But what I really wanted to share with you too is this is what your students need to know upon graduation to be able to come out and actually contribute in an equine practice. And horsemanship is a big one. And if you don't have access to horses and, you know, getting them to be comfortable around them, that's probably not something that the school needs to be responsible for, because most of the people who come in who are students and want to, you know, focus on equine, they probably have horsemanship background. They've had horses, they've worked around horses. But that is one of the key elements that an employer, a DVM, is going to look for, is if that person has horsemanship skills and can keep them, the client, and the horse safe. And that's just key. PPE, a pre-purchase exam, that is by far one of the biggest things that technicians help do in an equine practice, along with the lameness exams, neurologic exams. So the students need to know everything that is involved in a pre-purchase exam. You know, that goes for lameness exam, that goes for x-rays, that goes for blood work, that goes for, you know, sometimes riders are asked to get on the horse, to their mannerisms, you know, just there's a lot that goes into a pre-purchase exam and a lot of forms that goes in. There's a lot of legalities that are involved. And again, confidentiality is huge in the equine world. Joint injections are another big part of the equine practice. So students need to know where those joints are that are mostly tapped and worked with, how to scrub those properly, and bandage after the joint injection. What type of a bandage is involved, if a bandage is involved. And then surgical instruments, the equine surgery instruments are very different from small animal. So they need to know the instruments that are used for arthroscopy and for colic especially. Anesthesia, inhalant, and field and standing. I know all of you probably don't have access to an equine facility where you can watch this being happened, or your students be able to watch it or even be involved in it, but that is really pretty critical, because how a horse is induced and put under anesthesia makes most people just go, wow, if they've never seen it. You know, the machines that are used, fluids, we use totally different fluids than you would in small animal most of the time. The anesthetic agents, sedation, support therapy, all of that. They also really need to know how to document, invoice, and enter medical records from the field, because most of our practices are ambulatory. They're not, you know, in a actual, you know, facility, one room. They need to know endoscopy and gastroscopy. Those are huge elements as well in the equine practice. And then the modalities of scintigraphy, shockwave, PRP, stem cell, laser, your pulse, more and more technicians are also being asked to do ultrasound DR themselves, and then the veterinarian just reads them, or they're guided via telemedicine, you know, so they need to understand how a lot of that works in an equine practice. Bandaging, especially foot bandages, you know, the Robert Jones, splinting, treatments and pharmacology, you know, how we treat horses, what drugs we use, they are different from small animal. And so just being able to separate those out into a separate, you know, area for your students so that they understand them and, you know, kind of have an idea of what those are and why they're used in equine. They need to understand that horses and where they would be practicing might be on a racetrack, a show barn, a rodeo, horse shows, breeding farms, a rescue, or a rehab. So any of those areas, we are not just in a finite equine facility. Import and export, horses have passports. They need to know what those are, how to fill them out, the paperwork involved, and they need to know the regulations traveling between states. And the laboratory tests that are done on equine and the labs that we use, again, very different. So something that they, you know, they need to be aware of. And if we can help with your, you know, your externships, why are all my slides just going away? That's really crazy. Technology, oh goodness. Anyway, and then they need to understand also that ownerships in the equine practice are very, can be very complicated. There's agents that you're going to be visiting with, and farriers and trainers and syndicates, haulers. Many times the owner of the horse never comes into the clinic. And so who do you get those consent forms signed by? Who's liable? Who's responsible for the payment? And, you know, in a pre-purchase exam, for instance, who pays for and owns the x-rays? These are all things legally technicians need to know, your students need to know, because once they come out and start working in that practice, they, you know, can be put in a situation where, you know, could be detrimental to the practice or to the pre-purchase examination, and that whole process. They need to understand how ambulatory works and making appointments, scheduling the doctor on an ambulatory day, and then stocking an ambulatory truck, you know, getting a ambulatory veterinarian to come to your school and show you what a truck looks like and how it's stocked, would be huge to helping them understand that. And then our emergencies are very different: colic, choke, bleeding, fractures, birthing. So it's just a lot of these things are, you know, just so different from small animal. And I just want to know how we can help you help your students so they have a better grasp and they're better prepared when they come out. This is just a marketing flyer that, you know, we put out to our equine AEP and in our magazines to help, you know, educate the public and educate the veterinarian. So I guess too, I mean, I want to know how we can support you better in your roles as instructors or directors of programs. Our CE events are regional, and we do wet labs at every single one of them. So if your students need hands-on, want to see an anesthesia, you know, want to see a colic surgery, want to learn how to bandage, want to run an endoscope, this is where they can do it. I'd love to explore how we can expand, you know, externships and mentors, and, you know, we have, you know, a variety of practices who've already said they're willing, to accept externships. And then our online certificate program, I'm happy to discuss that further with all of you, but I think that's a huge asset. And we do work with schools to, do a program so it's not cost restrictive. Again, our equine manual, reach out to us as far as guest speakers and instructors for the day or the week, or however your school can help that happen. We have, members and board members and, people from our academy even that would be more than willing to help out. We just never get asked. And so we don't know. But, and then we have recorded webinars, proceedings, papers, a full library up on our website. Right now we have 2 anesthesia webinars that are running that they can, go and look at. And then we have a full career center, which all of you know right now is very robust because everyone's looking and there's just not enough to fill the need. And then, our biggest support I think that we can help you is educating the public and the AEP as to the value of the veterinary technician and what they are trained on when they go through a veterinary technology program. The equine practitioner, just to be very honest, they have very little confidence in the current graduates of a veterinary technology program. They are not looking for graduates right off the bat unless you have a relationship with a nearby equine practice. And that is probably one of the best things you can do because they can help you make sure that what you're instructing on is relevant, new, and then they get to, learn about who might be a potential applicant or an employee. They would rather train their own assistants or probably make up about 60% of every equine practice. And there's a myriad of reasons for that. But, the practitioners just don't trust the veterinary technology programs. They just have never had that relationship with them. So we hope to change that. Supply and demand, there's not enough. People are leaving the field, after 5 years. Many are going into small animal, many are going into, human. And so if we can help you create stellar graduates, that's what we want to do because they'll get noticed, the word will get out, and, hopefully we can get more involvement from the equine end to support all of you too. And we realize not all the programs can meet this initiative, and but we want to work with those that can, and where it's difficult or you don't have any equine at all, that's okay. But I just want to make sure you all know we're here to help you. And here's my information. This is our website. Please feel free to reach out to me, call me, text me. Sometimes it takes a while, but just keep bugging me. Any of our board or regional contacts, they are all listed up on our website. So if there's someone closer to you, please feel free to reach out to them. Please follow us on our Facebook page. That's where we post a lot of incredible information, cases, pictures. Students love gore and guts and blood. And we posted a really good one on enterolis today. It's also where we post about events that are going on or webinars that your students can tap into virtually through our sponsors. We've got great relationships with a lot of the sponsors. They support us. And so I think that's a nutshell, but I just kind of wanted to bring a little different aspect, there for you, and hope to be a resource. So I can quit sharing now and get back and see. Whoa, okay.
Yes, it looks like we do have a couple of comments and a couple of questions.
Okay.
So one of the first comments actually goes back to your challenges slide, and says that additional challenges are limited job opportunities, lack of utilization of LVTs by equine practitioners in their state. And I believe that Jolene's from Michigan. Yes. Okay.
Yep, that's all relevant and true.
Mhm.
We fight with it every day. Okay.
And then a good majority of equine facilities in Jesse's area won't accept vet tech students due to liability. I can understand that, but do you have any ideas or comments that I can use to help encourage the hospital to accept a student?
Again, it's creating a relationship, and what I would maybe try to do is work, with one of the veterinary technicians that is there and see, how can we, get a student to be able to observe, volunteer. They may have to volunteer there, and again, liability is so much bigger in equine because the horse is a fight or flight, and it can happen in an instant, and practices have to be very careful. You could create a release of liability. I would just try and build a relationship with the staff on board there, and see if that'll work. Maybe, I don't know, I'll keep thinking. Whoever that was, keep reaching out to me. I'll keep thinking.
Great. I'm going to go back to yours, Gordon, because it's a little long. So I just want to make sure we get this other question in first, if you don't mind. It says, our program is in PA, so Saratoga Springs is closest to us. What is the cost per attendee?
Okay, Tom, it depends. We haven't actually gotten that ironed out yet, but it runs anywhere from about 150 to 200. And then, if we have students that are interested in attending those wet labs, let me know, because what we'll do is create a student registration, which is usually around $100. If we're doing wet labs, though, as you can tell with horses, that can tend to be very expensive with the equipment that we have to bring in, bandaging, drugs, any of that. But stay in touch with me, and we'll try and get it out to you as well. We do have regional contacts who are trying to reach out to the schools. Our challenge is we don't know who to reach out to at each of the veterinary technology schools. A lot of times when you go on the AVMA website, it's a director. Well, they may not have anything to do with equine, and we go into a bucket. So helping us know who to reach at your school to, keep that relationship going is very, very beneficial.
Perfect. So I don't know if you want me to read out Gordon's or if you just want to read it to
Is
yourself.
he the big long one here?
Yes.
Good.
Mhm.
Wow, a lot of good information. Okay. Okay, I've got it.
Okay.
Okay, that's good to hear that there's some changes with the VTNE. Obviously, I have not sat for it in a long time. But I do try and ask students who have come out, especially when I was an instructor, are they asking, equine relevant questions? And I do understand that they are, asking more relevant questions. I was being way dramatic with the hoof pick. I was like, oh, what? This is my question. But yeah, the skills, I just, went in and reviewed the CVTA before this. And I think what's challenging for us from the AVT side is every time they call for input or they ask, it's open or whatever, we send them our list of, what we feel students need to know from the equine perspective. And it is very robust. And the answer we always get is it doesn't matter if it's equine, they're still studying anatomy and physiology and the basic overviews. So yes, but it's so different in the equine world. And we just want to make sure there's enough emphasis given and enough of the differences shown so that that appreciation is there. The use of the video. Okay, wait, maybe I don't understand this. By AVMA, CVTA, if a faculty member instructor is not directly involved with observation of the skill, it is through video documentation that will allow for sign off. Yeah, I understand that's okay. However, it's a disservice to our students. And I don't have the answer for that because I understand that's time, money, you know, all the reasons, you know, why they have gone to allowing video documentation. Yes, we are more than willing to, you know, talk to you now, especially that virtual's much more of a thing. You know, if you can get any of us on with a little Zoom for your school, and we're working on videos that, you know, show a day in the life of a veterinary technician, you know, regular things that they're doing and how to do them and little tips and tricks. And so we want to be able to share those with you. Like, you know, a video of a horse going down under anesthesia. I understand that's not being in the room when it happens, because that's a whole different experience, but at least they get to understand what it looks like. So hopefully this has been helpful. And, you know, I hope now, you know, some of you, any of you watching later, you have a resource and a contact, and happy to get with you with any of our board members or the, you know, the AAEVT members, our academy members, and our regional contacts. I just feel strongly that we need to do more. And I hope we can help that happen, because I don't want it to be all on all of you. But I just feel like we need to be more, I don't know, there for our students, potential vet techs. That's all I got.
Thank you so much. Even with the technical difficulties, it was a fascinating presentation.
Even with my slides going wonky, I'm like, what is going on there? Oh my goodness.
Hey, it's how you adapt to the situation that makes it.
That is one thing I've learned too, is that, you know, you walk into the equine clinic and there's, you know, an appointment book and you just throw it away because, you know, the one horse appointment shows up with 4 horses and there we go. But thanks very much for the opportunity.
No, thank you. And oh, I'm glad that you are now aware that AAEVT exists, Tom. That's great.
Yes.
So thank you for joining us today. And thank everyone. I thank everyone for joining us. And I thank you, Deb, for taking the time today to speak and bearing with me with the technical difficulties on our end.
Obviously mine too. So there we go. It was okay.
It all turned out perfectly. But if by any chance our attendees weren't able to write down your email or go back to the recording and grab it, do you mind if they reach out to me and I can connect you, or do you want to?
Absolutely. Absolutely. However it works.
Okay. Yeah. So then you can just email help@avte.net if you'd like to ask Deb any more questions. The slides will be available through the recording. And that will be on the website, hopefully by the weekend, Monday night at the latest. It depends on how technology cooperates. But thank you for coming, Jolyn, and everyone else. I really appreciate you coming, and I really appreciate your time and your patience and your understanding. And I appreciate the knowledge that you shared, Deb, and letting us all know about AAEVT. I think we could probably call that a wrap if no one has any other questions.